Hello, ladies. If you've gone through menopause or you are getting close, your doctor may have talked to you about heart disease already. But here's something they may not have asked you about, like what happened during your pregnancies. It turns out that certain pregnancy complications are one of the most important and most overlooked clues about your heart health right now, decades later. And for women going through the hormonal changes of menopause, understanding this history is more important than ever. By the end of this video, you'll know which pregnancy complications matter, why they matter, and most importantly, what you can do about them. So, how are pregnancy and heart health connected? Think about what pregnancy does to our body. Blood volume goes up by nearly half. The heart pumps much harder and faster. Blood vessels have to expand to support a growing baby. It's one of the most physically demanding things a body can do. For most women, the body handles all of this beautifully, but for some women, certain complications can develop. And research now shows that these complications can reveal an underlying vulnerability of blood pressure, of blood vessels that doesn't go away after delivery. It stays with you quietly for years, and here's why menopause matters in this picture. Before menopause, estrogen offers some natural protection to your heart and blood vessels. When estrogen drops during menopause, that protection fades, and any underlying risk that was already there can become much more significant. Pregnancy complications are now officially recognized as heart disease risk factors by the 2026 cholesterol guidelines by the ACC/AHA in the same category as diabetes and family history. Let's start talking about preeclampsia. What is it? Preeclampsia is a condition during pregnancy where your blood pressure rises dangerously, usually after 20 weeks. It affects about 1 in 12 or 1 in 20 pregnancies. You may have heard it being called toxemia or pregnancy-induced hypertension with protein in the urine. Many women who had preeclampsia were told at discharge, "You're fine, it's over, all is well." And while the immediate danger has passed, the story doesn't end there. What does research show? Research shows that women who had preeclampsia are twice as likely to have heart disease, stroke, or heart failure later in life compared to women who had uncomplicated pregnancies, and that risk grows as you get older. The reason is that preeclampsia leaves behind damage to the inner lining of the blood vessels, and that damage, combined with the hormonal changes of menopause, can accelerate the buildup of plaque in your arteries. If you had preeclampsia, your risk of high blood pressure later in life is nearly 4 times higher than average. Many women don't develop it until they're in their 40s or 50s, which is right around menopause. So, what can you do? Tell your doctor you had preeclampsia, even if it was 20 or 30 years ago. Ask to have your blood pressure, cholesterol, and blood sugar checked every year. Let's address high blood pressure during pregnancy now. Some women had high blood pressure during pregnancy without the full picture of preeclampsia. So, no protein in the urine, just elevated blood pressure. That is called gestational hypertension. It's quite common. It affects 1 in 6 pregnancies. Even without the other features of preeclampsia, this matters. Women who had gestational hypertension have about 70% higher chance of developing heart problems down the road, and up to half of them will develop chronic high blood pressure within 10 years of delivery. If this sounds like you, the good news is that blood pressure is very manageable when it's caught early. The key is knowing to look for it. So, what can you do? Don't assume that because your blood pressure was normal after delivery that it will stay that way. You need to have it checked at every doctor's visit. It can creep up gradually, especially after menopause. What about gestational diabetes? Gestational diabetes, which is the high blood sugar during pregnancy, affects about 1 in 10 pregnancies. Most women are told it resolves after delivery and the blood sugar often normalizes. But what the research tells us is more complicated than that. Women who had gestational diabetes are significantly more likely to develop type 2 diabetes within 10 years, and even before diabetes develops, they carry a 70 to 85% higher risk of heart disease and stroke compared to women who never had that. That elevated risk exists even in women who never go on to develop diabetes. The connection is that gestational diabetes is a sign of how your body handles insulin. That same underlying pattern combined with the metabolic changes of menopause can accelerate plaque buildup in the arteries and raise your cholesterol levels. Here's a key fact for you. If you had gestational diabetes, your risk of heart disease is higher, even if your blood sugar is normal right now. Menopause can make insulin resistance worse, so this is the time to pay close attention. What can you do about it? Ask your doctor for a fasting insulin level and fasting blood sugar level at your next visit. Even if you passed your postpartum diabetes test years ago, your risk warrants rescreening, especially after menopause. What about premature births? About 1 in 10 babies in the US is born before 37 weeks. That's called preterm birth. If your baby came early, especially before 34 weeks, and it wasn't planned by your medical team, it is worth discussing with your doctor today. Women who delivered spontaneously before term are twice as likely to develop heart disease and have a 70% higher risk of stroke over their lifetime. The earlier the birth, the higher the risk. This connection exists because premature birth, when it happens on its own, not because doctors induced it, often reflects a problem with the placenta and the blood vessels that support it. Those same blood vessel issues can show up later as heart disease. So, what can you do about it? If you delivered before 37 weeks spontaneously, mention it specifically to your heart doctor or your primary care provider. Use the word spontaneous preterm birth, and it gets noted in your chart. Two other experiences that can carry long-term heart implications are placental abruption, which is when the placenta separates from the uterine wall too early, and pregnancy loss after 20 weeks, also called stillbirth. Both are associated with roughly a twofold increase in heart disease and stroke risk over a lifetime. These are painful experiences that many women carry quietly for years. It can feel strange to connect them to your heart health now, but the connection is real and it matters. The underlying reason is similar to the others. These events are often linked to problems with the placenta's blood vessels, and that's a sign of how your circulatory system was functioning under the stress of pregnancy. Here's a key fact for you. You don't need to have had multiple pregnancy complications for this to apply to you. Even one of these experiences is enough to warrant closer look at your heart health. So what can you do about it? If you experience stillbirth or placental abruption, please tell your doctor, even if it feels too personal and it was too long ago. It belongs in your medical history. You deserve the follow-up care that comes with information. Now, what does that mean for you now? Here's the most important thing to take away from this video. Knowing your history gives you power. These conditions increase your risk. They do not determine your fate. Heart disease is largely preventable, and the steps that protect your heart are the same ones that improve your quality of life through menopause and beyond. So, 5 things to start doing now. 1, tell your doctor your full pregnancy history, every complication, even from decades ago. It belongs in your chart. 2, get your numbers checked. Blood pressure, cholesterol, including LDL, ApoB, triglycerides, and your blood sugar, and ask what the results mean for your personal level of risk. 3, ask if you need a heart risk score. There are new tools like Prevent ASCVD Calculator from the 2026 AHA guidelines that can estimate your 10 and 30-year heart risk using your personal health information, not just population averages. 4, focus on what you can control. A heart-healthy diet like the Mediterranean diet has some of the strongest evidence. 150 minutes of moderate exercise a week, not smoking, getting 7 to 9 hours of sleep a night. 5, ask about women's heart program or a cardiology consultation if you have multiple risk factors. You do not want to wait until something goes wrong. Another key fact for you: heart disease kills more women than all cancers combined, but it is largely preventable. Women with pregnancy complications are among those with the most gain from early intervention. So, what can you do before your next doctor's visit? Write down your pregnancy history, any complications, how many weeks each baby was when he or she was born, and any hospitalizations during pregnancy. Bring that list with you. Your pregnancies and anything that happened during your pregnancies are part of your health history. They're not ancient history. They're not something to set aside. A real meaningful part of who you are medically right now. If you had preeclampsia, gestational hypertension, gestational diabetes, preterm birth, a pregnancy loss, or even heart failure around delivery, your heart deserves extra attention during menopause, not because something is definitely wrong, but because you have information that most women don't have, and you should use it. Talk to your doctor. Ask the questions. Get the screening. You've already been through a lot. Let's make sure your heart gets the care that it deserves for everything that comes next. Thank you for watching.